Hi, I'm McClocklin. I'm 56 years old and I'm from British Columbia, Canada. I'm an athlete, former ultra runner, and amateur bodybuilder, and critical care, cardiac critical care nurse. Approximately the end of 2017, beginning of 2018, my symptoms of right leg lymphedema emerged. I had swelling of my right thigh, my buttock, on the right side, as well as pain. After my symptoms emerged, it was a 2-year exhaustive history of tests and medical referrals. Probably 2 years after that, then I began to wear compression garments. I'd had quite a bit of imaging, and then I was definitively diagnosed with right leg lymphedema. I started using compression garments, I would estimate regularly at about 2020, I want to say approximately, and doing regular decongestive therapy with a lymphedema therapist. And I was always eating clean and exercising already. So. Oh, wow. This is the amazing part. Well, you have to appreciate that while all this was happening, my symptoms were getting progressively worse. I had great debilitating pain in my right leg, and I was not able to perform my duties at work. It meant cessation of all my regular activities. I couldn't run, I couldn't work out. I was in constant pain, and this was very motivating. I started doing my own research, and I came upon Dr. Cheng. I knew that he had many peer-reviewed papers, and I'd read a couple of them, and then I found on the internet his A+ surgery clinic, and he described the procedures that he did, described the clinic, and I read some testimonials, particularly from a girl that had a similar situation as mine, and I think that was how I found him. Yeah, and I saw interviews with him and other surgeons, so it helped me I realized that he was a world leader in the area of microsurgery for lymphedema. Well, this is the interesting part. Although Dr. Cheng is very, very busy, he's a professor, author, he's a practicing surgeon, he still managed to find the time to answer my email, and he provided information, answered my questions regarding the procedures that I thought I would be eligible for. He explained everything in emails to me, and I sent him in turn photos and lab results, and we established a relationship of trust, and I had confidence that he would be the right person. Well, the difficulties that I encountered were more to do with finding, I had to find accommodation that was in close proximity to the clinic. That was one of the things that, trying to figure out on a map how far away things were, and just the logistics of the travel, putting the travel together. That was probably a little bit challenging for me, and it was my first trip to Asia, so I wasn't sure how I was going to be able to manage, but Google Translate was helpful, and most people can speak some English, so it's good.
So did you feel very difficult to use the English in Taiwan?
That's a difficult question. Not within the clinic so much, but outside it was a little bit more difficult. Yeah, it was a little bit more difficult, in all honesty.
So did you want to share your experience to help the patient, if they want to come to Taiwan, how they can find the hotel?
Okay, I can recommend the hotels that we used, but if you can find a hotel within 5 or 10 minutes walking distance from the clinic, that's what I would recommend. I would also recommend that you arrange for wheelchair rental following your procedure. That will make it far more pleasant. You won't be confined to your hotel room upon discharge. When you're feeling a little bit better, you'll be able to be out and about even if you're not fully weight bearing. So those are two things I would recommend. Dr. Cheng is a very competent, expert person in his field, and he's an incredibly humble person. He has a lot of knowledge that he's very willing to take the time to explain and share with his patients, and I think education is a huge part for having a successful outcome of your surgery. I really appreciated that the clinic did interdisciplinary rounds every day. I was met by Dr. Cheng as well as the nursing team and the fellow, and they would physically examine my progress and discuss next steps with me. So I felt that I was well cared for. It was a vascularized lymph node transfer. So mine involved taking from the submental area of the neck the lymph nodes, approximately 4 lymph nodes, and they were transferred to a flap in my ankle. And so by gravity, the use of gravity and kind of a catchment effect, the lymph is able to be returned into the venous system because they take the actual vessels, the artery as well as the vein, and that is also transferred to the flap in the ankle. Yeah, it's a really amazing surgery. Oh, wow, how much improvement. Well, this has had a hugely positive impact on me already in this very short time after surgery. I immediately experienced pain relief of my right thigh, and my leg the pain was instantly gone. I experienced softening of my tissues. My leg, my thigh, and my calf were both very soft. And within days, I measured the girth of my leg, upper and lower, above and below the knee, and I had a 5-centimeter reduction in my thigh, and I could feel everything was lighter. And I just think it's unbelievable. And this is incredible because it's without any compression. And I've been wearing compression, I want to estimate maybe about 5 years, like I want to say about 5 years at least. And that I never felt this kind of, never experienced this kind of result. You know, I really feel compassionate towards people that are suffering from lymphedema, and if there's anything that I can offer as a message of hope, I would like to say there are experts available, and I'm in the company of one of the world's, if not the world's best expert leader in this area, and I have complete confidence in Dr. Cheng, and I think he is a very humble, capable, professional individual with a great team behind him of nurses. I would highly recommend that you consider having an assessment and exploring your surgical options with him. The only words are thank you, thank you, thank you. You've given me back my life, and you can't put a dollar sign on any of this. This is priceless. And I owe you all a world of gratitude. And I would like to extend an invitation to anybody that would like more information or would like to talk to me and get a patient's perspective to please feel free to contact me via email at icurun26@hotmail.com. That would be great. I'm happy to answer your questions.